Hello, welcome to today's discussion. And today we want to dive into a very important topic that concerns the future of public health. Today we want to dive into the pandemic instruments. And these pandemic instruments is founded on three key components: governance, systems, and financing. And the three components are founded on equity, inclusivity, and fairness. Let's break it down. Governance. And why is it important? This is very important because think of governance as how we manage our affairs when we have a crisis. So who do we look up to when we have a crisis, such as COVID-19 pandemic? Under governance, we have three key components: leadership, regulations, and accountability. Under leadership, the World Health Organization has proposed a global health emergency committee or emergency council. So think of this as a council that will lead us in responding to an effective response to a public health emergency. And this is very important. Under regulations, think about the International Health Regulations 2005. And these regulations guide countries in improving preparedness, response, and recovery from public health emergencies. So we need to update, we need to revise international health regulations and have them evolve and have them step up to the evolving and emerging public health emergencies such as COVID-19, Marburg outbreak, and Mpox outbreaks. Number 3, under governance, we talked about accountability. Accountability, think about checks and balances. We'll need to hold member states to account. By doing monitoring on health emergency preparedness capabilities, we are able to know what works and what doesn't work. And based on that, we are able to improve our capabilities for an effective response to public health emergencies. And that's about governance. Now let's go to systems. When we talk about systems, think about the tools and the networks that we need to develop for collaboration, capacity, and coordination. By collaboration, we mean for an effective response to public health emergencies, we will need people to work together. We will need World Health Organization member states to work together. For example, in cross-border disease surveillance and disease prevention efforts, that will be critical. Number 2, when we talk about capacity, we are talking about skilled frontline responders who will effectively and timely respond in the containment of a public health emergency, such as during what happened during COVID-19 pandemic and what is happening now for Marburg and Mpox outbreaks. Then when we talk about coordination, it is one thing to have resources, it's another thing to have those resources to work in a coordinated way to address a crisis. So those things are very important. And finally, financing. Responding to global health emergencies or public health emergencies requires significant domestic and international investment. We'll talk about 3 key components of financing: predictable financing, number 2, catalytic financing, and number 3, we talk about scalable financing. When you talk about predictable financing, we should be speaking to the need not just to respond to a public health emergency with our resources. There is need to proactively prepare for public health emergencies through domestic financing and through international strategies for financing. Catalytic financing or catalytic funding. This is crucial because during a public health emergency, gaps in financing arises. So we need strategies, gap filling strategies. For example, no matter the level of preparedness, sometimes we will still have gaps in financing. So very important that we prepare strategies for catalytic financing where there will be gaps during a crisis. And in terms of scalable financing, it's very important that we have contingency funds to scale during a public health emergency, such as during COVID-19. So when we talk about scalable financing, public health emergencies move from the community level, the outbreak evolves into the subnational level, into the national level, and then the outbreaks becomes a pandemic. So similarly, that is how we need to scale up our financing. In conclusion, for an effective response to a public health emergency, we need to understand these pandemic instruments that we have just described in this video, constituted by governance, systems, and financing. And the three components are founded on principles of equity and inclusivity. Let's keep this conversation going for the future of our public health. Thank you.